Hi everyone, I want to tell you a little bit about SPD or symphysis pubis dysfunction. 3 things to tell you today. The first thing is that I hate the term SPD or symphysis pubis dysfunction, and we're not actually using it anymore. We're now referring to it as pelvic girdle pain. During pregnancy, a lot of women will have pelvic girdle pain, about 1 in 5, and the whole thing I want you to be aware of is that your pubic bone is not broken. A lot of women come into me feeling that their pubic bone is about to split apart, and this term, symphysis pubis dysfunction, I think actually kind of reiterates that. So I'm moving away from SPD in my language now. What actually happens during pregnancy is that your pubic symphysis does actually widen. That gap is meant to widen, and that's due to a hormone called relaxin. So that is normal. What is not normal, and this is getting on to point 2, is when we're having pain in that region. And the reason for this pain is normally down to a dysfunction in the muscles, so not the joint itself. Some women will be hearing clicking and grinding within the pubic symphysis because of the lack of stability, but what we need to do is make sure that the muscles around this region are functioning properly. So the third point is, what is the treatment? Well, it's about getting those muscles functioning properly. We need your gluteals to be strong. So they're your bum muscles. They're what stabilize your pelvis. And we need the groin and the pelvic floor muscles not to work too hard. And this is what I see in most women with this pain, is that the groin and the pelvic floor are working too hard. They're switched on all the time, and you're relying on them to stabilize you. And that's just not going to work. So I suggest that if you have any of this anterior pelvic girdle pain, that you contact me if you're in my area, so in Dublin or in Kildare or any area around there, come to see me. Otherwise, I will put you in touch with a pelvic physio in your area, and have your pelvic floor, your gluteals assessed, making sure that you're addressing the imbalance so we can restore your function and movement. That's the most important thing, so you can keep active and fit during your pregnancy.